and avoiding excessive calories. What diet should we be following? So the Mediterranean diet is actually the most studied diet in terms of cardiovascular disease, um, and the most proven benefit in cardiovascular disease. Here are some of the things that you eat on the Mediterranean diet. As you see here, on rare occasion, do you eat processed meats or packaged foods? Less often, you want to eat red meats and sweets. And as you see here at the bottom, you want to be eating a lot of vegetables, fruits, whole grain breads, cereals, extra virgin olive oil, nuts, legumes, seeds, things like that. And then a couple of times a week, eating fish and seafood. Physical activity is a big thing. So fewer than 5% of African American adults exercise um, more than 45 minutes a day, most days of the week. The AHA recommends at least 150 minutes of moderate intensity aerobic exercise per week or 75 minutes of vigorous exercise. Combination is usually recommended. And then adding moderate to high intensity weight training a couple of times a week is also helpful. We need to be spending less time sitting. So if you guys have some free time, make sure to join us for the walk coming up soon. So what are some moderate intensity exercises? Brisk walking, water aerobics, dancing, gardening, tennis, usually doubles tennis, which is less strenuous, biking, pushing a lawnmower, and hiking. And then some of the vigorous exercises include hiking uphill, running, swimming laps, aerobic dancing, heavy yard work, tennis, cycling at a speed of 10 miles per hour or greater, and then jump rope. Thank you guys for listening to me today. Does anyone have any questions?
Yes. Thank you, Dr. Prince. That was a great presentation. We have a couple of questions for you. One of which was, could you show the blood pressure slide again and reiterate what is an ideal blood pressure reading?
So yes, here is the blood pressure slide. Normal blood pressure is usually less than 120 over 80. Um, but the goal blood pressure is usually less than 130 over 80. So usually we don't add any medications or anything until you've gotten to that 140 or higher level.
Okay, thank you for that. Another question that came in was, can an individual test their A1C with an over-the-counter device, or can it only be tested by a physician in a lab?
Uh, it's usually just tested by a physician in the lab. It's a blood test.
Thank you. The next question is, can you differentiate um, abdominal pain and indigestion from a heart attack? How would somebody know the difference between the two?
No, you cannot always differentiate that. So, if you have pain anywhere near the heart, like upper abdominal pain, and it's persisting for, longer than 30 minutes or so, and you don't have a history of reflux disease, and this pain is similar to that, um, then you probably need to seek medical attention.
Okay, thank you. Another question. We're only going to spend about 5 minutes in this. So just if the questions are not answered, we will send the answers out to all the registered participants after the webinar. So just wanted everyone to know that if we don't get to it, we will definitely get you the answer. The next question, Dr. Prince, is how often should the doctor do a stress test instead of just depending on an EKG?
Yeah, so this is a good question because a lot of people are under the impression that, oh, I need to get a stress test yearly. But that's actually not the case. Usually, we just need to do stress tests whenever people have symptoms. So if you're not having any symptoms and you're doing, doing your day-to-day activities without any shortness of breath or chest pain or anything like that, um, you don't really need to get a stress test. Now, there are some instances where people have a family history of heart disease, and their mother or father had a heart attack at 40 or 50 years old, and those patients, we would be more likely to get a stress test in.
Okay. And then I have a question about the DASH diet. Is the DASH diet good for people with hypertension?
Yes. So the DASH diet is good for people with hypertension because you're replacing sodium. Usually the Miss Dash is replaced with potassium um, instead of sodium. So people with kidney issues and things probably should be aware that in the Dash diet, the sodium is actually replaced with potassium. And so, but yes, overall, it is a good diet for people with high blood pressure.
Okay. These are some really great questions. Okay, so hard to choose. Okay, how can you research your doctor's expertise or specialties when choosing a physician? For instance, if they are advocates for limb preservation, if that's a concern of yours.
Oh, that's a great question. Usually, if somebody is an advocate for limb preservation, it will be on their website or things like that. But the thing is, a lot of people don't know that limb preservation is actually a thing. Oftentimes the doctor just says, "Oh yeah, we've got to amputate," and they say, "Oh, well, that's the only option we had." But the we have to get the word out that there are actually um, possibilities to save limbs.
Okay, thank you. And then, are there any routine or annual medical tests that can be done to be aware of your heart health?
Usually just following up with the doctor, getting, annual checks of your blood pressure, your cholesterol, your blood glucose levels, and that's usually it.
Okay. And what do you recommend as exercise for older adults?
Well, I guess it depends on if you have arthritis or different other joint ailments. If you do have those, then the pool obviously is a great exercise. Biking is also, a good exercise that isn't weight bearing and hard on your joints. So those are a couple of different activities.
Okay. And then this is going to be my next to last question. Two people asked this. So, how often should you get an EKG?
Um, You don't really need to get an EKG unless you're having chest pain or different symptoms like that. So there's not really a, you know, particular time frame on when we need to get those.
Okay. And the last question is, can clogged arteries be reversed with diet or lifestyle changes?
That's a great question. So there have been no real proven studies that suggest that arteries can be, coronary artery disease can be reversed. There was a documentary, if anyone cares to watch, called Forks Over Knives, which was on Netflix, um, where they took a bunch of patients, bought them groceries, and basically put them on a plant-based diet, and they actually noted that there was reversal in coronary artery disease. However, this isn't really a randomized control trial or study that, has been published. But yes, eating more fruit, eating more vegetables, or would definitely be helpful.
Okay, thank you. I'm so sorry. There's some really good questions, but again, this recording, yes, there's one. This recording will be available on our chapter website as well as Facebook. And then for those questions that were not answered, I'm sincerely apologize, but we will get the answers to you since you were a registered participant. But we have to get to our next speaker. Dr. Prince, if you don't mind advancing for me. Our next speaker is Miss Paige Glover. Paige is the Director of Development for the Central and South Texas chapter of the American Diabetes Association. She is responsible for advancing revenue development and building invaluable relationships in Central and South Texas to fund the organization's mission to prevent and cure diabetes and to improve the lives of all people affected by diabetes. Paige joined the American Diabetes Association staff in 2021 and brings 19 years of development, programming, and sales experience, 14 of which were spent with national health not-for-profit organizations. Paige earned her bachelor's degree from Texas A&M University in College Station and currently resides in Friendswood, Texas, with her husband and 2 young boys. After her presentation, you will have the opportunity to ask questions as well for a brief Q&A, just like we did with Dr. Prince. So without further ado, Paige Glover. You're on mute, Paige.
My apologies. Hello, everyone, and thank you so much for the opportunity to be here with you today. I'm here to share our Diabetes 101 program with you. This program was developed to provide you with general information about diabetes and connect you with resources available through the American Diabetes Association. I'm pleased to be here with you all today to discuss diabetes in honor of National Minority Health Month. I'd like to clarify that although I am able to share this presentation with you today, I am not a licensed physician or diabetes educator. Therefore, I won't be able to address any technical medical inquiries, but I am able to direct you to resources available through the American Diabetes Association. In the United States, there are 34 million people, or 1 in 10 Americans, diagnosed with diabetes. And every 21 seconds, someone in the United States is diagnosed. These numbers really emphasize how diabetes affects so many people today. Diabetes is a public health crisis. And as this slide indicates, diabetes disproportionately affects various ethnic and minority populations. Compared to non-Hispanic white adults, American Indian and Alaskan Native adults are almost twice as likely to be diagnosed with diabetes. Black and Hispanic adults are more than 70% more likely to be diagnosed with diabetes, and Asian Americans 25% more likely to be diagnosed. It is an important fact to highlight, especially during National Minority Health Month. As you can see from the information we just discussed, diabetes affects everyone. And the American Diabetes Association, also known as the ADA, is the largest national nonprofit organization pursuing treatments, prevention, and cures for all types of diabetes and fighting for the rights of all people affected by diabetes. This is what sets us apart from other diabetes organizations. The ADA is internationally recognized and a trusted authority in diabetes care and education. Our evidence-based standards of care in diabetes guides healthcare professionals and informs diabetes care and education specialists around the United States and the world. The standards of care are updated yearly, and its recommendations are based on extensive review of current clinical diabetes literature with input from experts, including medical, scientists, researchers, and the medical community at large. This is a resource for healthcare professionals and ensures a quality standard of care for all patients diagnosed with diabetes. The mission of the ADA is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. This is a comprehensive approach to change lives. From the science and research that we support, to the advocacy we do on Capitol Hill, to the support that we provide our healthcare providers, and to individuals and family members nationwide, the American Diabetes Association is there. You can visit our website, diabetes.org, to learn more about what we do and to find out ways that you can be involved. So now that we have provided some general information about diabetes and the American Diabetes Association, we will now dive into discussing prediabetes and diabetes. So what exactly is prediabetes? Prediabetes is when your blood glucose, also known as blood sugar, levels are higher than normal, but aren't high enough to yet be diagnosed as diabetes. Prediabetes affects 97.6 million American adults. And the staggering figure here is that 81% of American adults do not know that they have it. This may be due to the fact that there are no clear disease symptoms of prediabetes, and we'll be covering some of the signs and symptoms later in this presentation. So not only can prediabetes lead to type 2 diabetes, but it can also lead to many serious complications. Having prediabetes puts the individual at a higher risk for developing type 2 diabetes, heart disease, stroke, and more. But this is an opportunity for people to take action and prevent or delay the onset of diabetes. You can learn your risk for prediabetes and type 2 diabetes, as well as understand the steps to lower your risk by taking our online risk test at diabetes.org/risk test. This risk test is an easy tool to get an accurate risk assessment along with some achievable next steps based on your results. You can even print your test and take it to your provider to discuss it with them as well. I do want to also mention this risk test is available online in English and Spanish, and as well as print, Braille, and other languages. We encourage you to share this risk test with your family, friends, and coworkers, as this is an important first step to understanding your risk for diabetes. Now we'll be transitioning from prediabetes to diabetes. When you have diabetes, your blood glucose levels rise higher than normal. There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. If you have diabetes, your blood either doesn't make enough insulin or can't use the insulin it makes properly, or both. Diabetes does increase your risk for many serious complications. The good news is that by managing your diabetes, many people with diabetes are able to prevent or delay the onset of serious complications. So whenever you talk about or explain diabetes, the question will likely come up: how is food related to diabetes? When you eat, your body breaks food down into glucose and sends it into the blood. Insulin, a hormone made in the pancreas, then helps move the glucose from the blood into your cells. When glucose enters your cells, it is either used as fuel for energy right away or stored for later use. In a person with diabetes, there is a problem with insulin, but not everyone with diabetes has the same problem. It is really important to know the signs and symptoms of diabetes. These symptoms can include urinating often, feeling very thirsty, feeling very hungry even though you're eating, extreme fatigue, blurry vision, cuts and bruises that are slow to heal, weight loss even though you're eating more, typical in type 1 diabetes, tingling pain or numbness in the hands and feet, typical with type 2 diabetes.